We've got this question from Savannah, and she asks, why can't caregivers, still under the same program, especially those who are nurses, be allowed to immigrate as permanent residents with their families to fill shortages in domestic work the same way other immigrant workers can do to work at other
Oh, they
fields?
absolutely can. Anyone who applies to come in through the Live-In Caregiver program could also instead, or in addition, apply for any of our other immigration programs. So if it's a nurse, I would recommend that they apply like all other nurses do through the either the federal skilled worker program, and nurses are one of our priority occupations in that program. In fact, new applications in that federal skilled worker program, for example, nurses, are being processed in about 10 months' time. Or they could apply for permanent residency through a provincial nominee program. If an employer, let's say Manitoba or Saskatchewan, nominates them to come and work in a hospital as a nurse, they can come through that program. Or they could come and take additional courses in Canada, get a nursing diploma or degree as a student, and then apply through the Canadian Experience class. So there are all sorts of other opportunities for such individuals to come in as immigrants to Canada.
Okay. And she has a follow-up. She says, most of the issues around poor working conditions under the program come from a requirement to live in an employer's home, falling under temporary worker status. And she says that makes them vulnerable to arbitrary deportation. She wants to know if you plan to address those issues.
Okay. Well, first of all, we've taken measures to better protect caregivers. For example, we now have a mandatory contract which stipulates what the obligations of the employer and the employee are. We now have a system of information sharing with the provinces. So if they hear reports about abusive employers, we learn about that. We can add those employers to a blacklist to ensure they don't get access to caregivers in the future. We've also moved the burden of costs in this program from the caregivers to the employers. So recruitment fees, health insurance, and most of the travel costs are now borne by the employer to make sure they're really committed to the program, to their caregiver. And we've also eliminated, this is a technical thing, something called the second medical requirement. So basically, if a caregiver gets sick in Canada, they won't be penalized in their application for permanent residency. So we've done all these things and we're also providing more information and training to caregivers before they come to Canada and when they're here to know their rights and to be able to report abusive employers. But in terms of eliminating the live-in requirement, well, that would end the program. I mean, the reason we have such a program is because Canadian families have no trouble finding caregivers who will come in during the day as live-out caregivers, if you will. There's no shortage of applications for that. But when they go and apply for people who they need in the home to care for elderly relatives or young children, then Canadians are not applying for that job. So this is a particular occupation with a particular need that Canadians are not applying for, which is why we have the program.